It is a pre-malignant condition which, not treated effectively, can develop into cancer. So this is a pre-malignant disease related to the invasive cervical cancer. It can fade naturally up to CIN1 condition, can run to invasive cervical cancer also. So dysplasia is a term that is used to cite. It is a cytological term to describe cells remembering the cancer cells, but they can be reversed. It's a normal change of the cell size and shape. The nucleus, the cytoplasm of the cell will change. So CIN refers to the histopathological description. That is, when you take a biopsy and send it for histopathology, then this term is used, CIN, that is intraepithelial neoplasia, a part or full thickness of the stratified squamous epithelium of cervix is replaced with the dysplastic cells. So how much part is occupied, basing on that we will call CIN 1, 2 and 3. So squamous intraepithelial lesion includes the HPV, human papilloma virus, and also CIN, that is after the invasion of HPV developing into CIN. So another terminology is low-grade squamous intraepithelial lesion, high-grade squamous intraepithelial lesion, LSIL and HSIL. So this is one more terminology. So the both are same. LSIL or CIN1 is one and same. HSIL and CIN2-3 is one and same. So pathogenesis of the cervical neoplasia is initiated by sexual activity, then HPV exposure, the normal glycogen containing mature squamous metaplastic epithelium, it will remain like that, or infection with oncogenic HPV types lead to the dysplasia. Anything can happen, and it leads to it. And the major pathology happens in the cervical transformation zone. So this zone is very, very important to identify the cervical cancers. So this is important anatomical area, almost from the ectocervix to the 2 to 3 centimeters till the endocervical area. We call it as a transformation zone. So here the squamous differentiation will take place, and it will also can take place endocervical columnar differentiation. That is, the dysplasia can occur in the squamous epithelium, that is on ectocervix, or in the columnar epithelium, endocervical area. So the diagnostic standards are a simple pap smear, which is simple spatula. You can collect the cells of the ectocervix and endocervix and send for cytological study, and visual inspection with acetic acid and visual inspection with leukocyte. These two are the reagents which we apply on the transformation zone, and with a good lighting source, we will see what are the cell changes which indicate dysplasia. And the next investigation is colposcopy. This is nothing but a magnified lens. We can see the changes on cervix, and if needed, wherever you feel the abnormality, you can take a biopsy. So these are the gold standard diagnostic methods for identifying the premalignant lesions or invasive cancer cervix. So these are some of the equipment you need to identify the premalignant lesions. This is a spatula to collect the cells. This is normal saline, acetic acid, leukocyte, a simple Cusco speculum. You can do the procedure. So visual inspection with acetic acid, that is done with the glacial acetic acid 5%, diluted in 95% of distilled water. And the principle is it coagulates the abnormal proteins over the transformation zone. So this gives a very white color picture. That's why we call them as aceto-white lesions. And next one, Lugol's iodine, is the principle in applying the Lugol's iodine is it is like the squamous epithelium over the transformation zone is glycogen rich. So it will change its color when it is having dysplasia. So it is a glycophilic agent. So it will turn into mahogany's brown color when there is a dysplasia. So this is a very simple method to do in very low resource setting also. And pap smear is just you can take and you can send to any pathology lab for the cytology study. And HPV virus detection is the DNA detection, you have to collect the cells for the liquid-based cytology, or normal cells also you can collect for the HPV evaluation. So this is a simple cusco-speculum visualized pictures of the cervix. This is a cervix. This is a transformation zone. This is after application of acetic acid. You can see some positive white areas over the. So this is a very strong positive aceto-white area. And after the application of Lugol's iodine, you can see the positive area has turned into mahogany brown. The same, this is a colposcopic picture. So this is a case of CIN1. You can see the pathology marked here, diagnosed on the biopsy. And for this, you can do if the patient age is very young, you need not go for hysterectomy. Just remove this transformation zone. This is called LEAP surgery, loop electrical excision procedure. The complete transformation zone is removed, then the patient is free of any further development of invasive carcinoma. No need of going for any hysterectomy. So this is about the HPV virus. Nearly 100 viruses are present, but all are not causing cervical cancer. In the previous slide, I have shown what are the probabilities of the number of HPV causing the cancer cervix. And the two oncogenic proteins, that is E6 and E7, these are the more dangerous proteins of HPV virus. These will bind to the host genome DNA and alter the cell growth, and that goes into the dysplasia. And the inhibitory factors, P53, this is a tumor suppressor gene, so it repairs the broken DNA. But sometimes because of the HPV attack, this P53 will be deficient in particular patient. So to identify the HPV, liquid-based cytology around cost 4,000 to 5,000, a little bit expensive. So nucleic acid basing testing is a little bit comparatively on lesser economic burden to the patient. That can be done with the polymerase chain reaction, and hybrid capture also can be done with the two procedures. So this is to identify the HPV virus. And two vaccines are also available, Gardasil and Cervarix. So these are given before the first sexual intercourse. But the question is, only 95% of the cancers will be prevented, cervical cancers, with this vaccine, which are HPV related. If there is any genetical predomination, that cannot be prevented. So finally, the point comes, prevention is better than cure, even with the vaccination. So regular screening of the patient is very, very important to prevent the cervical cancer. That is the only gold standard technique to prevent the cervical cancer. So need for integrated approach and scope of Ayurvedic management. What we can do in this cervical pre-malignant lesions. So 15% of women fail to clear the virus, leading to persistent infection. With vaccination, without vaccination, whatever it is. So here the major culprit is inflammation. Inflammation plays a very critically important role in regulating the pathology of cervix, susceptibility to infection by virus, HPV and HIV, and because of this, patient outcome is adversely affected. So managing inflammation in these women to prevent disease progression, especially progression of cervix, invasive cancer, it is a very big challenge. So here, the integrated approach with Ayurveda will help. So neoplasia or Buddha can be considered. So it can be benign or it can be malignant. So the malignant ulcers in Ayurveda are considered as asadhya vrana. So in Sushrita Nidanasthana, he has given one reference, mushti praharadibihi. So this indicates irritation and trauma may precipitate or activate the formation of arbuda. So here it goes very well with cervical cancer because sexual intercourse is a major factor for the trauma and also irritability. Both are there. So invasive cancer versus asadhya ardhavadrushti. So which condition we can relate with the invasive cancer? So it is asadhya artava dushti. It is the features you can see here, kunupagandhi, that is emits the dead body smell because of the necrotic tissue, menorrhagia, and grandhi bhuta, that is presence of clots with the slump in advanced CA cervix. You can see puti poeniba, purulent discharges with putrid smell, mutra purisha gandhi, PV bleeding with the urine, fecal odor that is seen in the vesicovaginal and vesicorectal fistulas. And also Sannipataja Asruddhara. These also have the same features. So these condition we can consider as invasive CA cervix. So asadhya arbudas are mostly tridoshaja and mamsa arbuda, rakta arbuda, fast growing muscular growth with continuous discharge of vitiated blood. So this is mostly apt suitable for the CA cervix. Now coming to the pre-malignant lesion. So which condition in Ayurveda? So to go for integrated approach, we have to understand which condition in Ayurveda can be related to the pre-malignant lesion. So we can consider Sannipataja Yoni Vyapat. So the reference from Charaka Chikitsa, you can see Samsanatya Rasan Sarvan Dushayetva Trayomala Yoni Garbhashayasta Svair Yoni Yunjati Lakshanaihi Sadaha Shula Artha Sveta Pichila Vahini. So this indicates that by consuming very irregular diet, patya mixing, and different rasas. Nowadays you can see the preparation, food preparation also, all viruddhaharas are mixed. So because of this, the tridosha situated in yoni and garbhashya gets vitiated and produce the native symptoms, that is whichever the dosha is predominant, or tridosha, all the symptoms you can see like daha, shula, shveta, and pichila, shrava, artava. And Chakrapani particularly has given one important feature, that is Anruta Kala Artava. That is Sannipatika Pradara Rupa. Anruta Kala means we can say intermenstrual bleeding, which is not coming in time. So this is also one feature of pre-malignant lesion, characterized by mucosanguineous vaginal discharges whenever there is highly inflammatory condition of the cervix. Characterized with pre-malignant lesion, this type of features you can see, and if it is not treated in time, can lead to padravas like Yadapatyapada Moolam Narya Gulma Arsha Pradaradimascha. So it can lead to Gulma Arsha. Gulma is also considered as one of the malignant condition. So pre-malignant lesion not treated can lead to the malignant condition. And Sannipataja is considered as incurable. So if proper approach is not given to this condition, it can lead or it can progress to the incurable condition of the CA cervix. And also Kashyapa has clearly mentioned Artha Nidana. The reason is Rajasvala Rutur Vyapadyate. That is during the Rajasvala period or in the Rutukala period, if abnormal dietetics and mode of life is maintained. Sorry. Please advise.
Delegates, please.
So, this type of condition you can see in this pre-malignant lesions. So, particularly the clinical picture, 99% cases in the initial CIN1 stage, no symptoms are seen. But sometimes patient may give a picture of postcoital bleeding. You can consider as Anruta Artava, vaginal spotting, intermenstrual, that is also same condition. Abnormal vaginal discharge, that is Shveta Neela Pita Shravas mentioned in Ayurveda, and clinically suspicious cervix on examination. So these are the clinical pictures of pre-malignant lesions. So when you want to apply the Shatkriya Kala, because when you can involve with the treatment and how to understand the pathogenesis in the pre-malignant lesion. So I have already mentioned inflammation is the key feature. So if you want to see this, the involvement of Kriya Kalas, it is a complex, inflammation is a complex biological response of the body tissues to the harmful stimuli. So initially the pathogenesis start with inflammation. So this is either it can be any irritant or sexual intercourse, and in a protective response, this immune cells will be involved, including the blood vessels, and these act as a molecular mediators, and the inflammation like picture is seen. So the function of the inflammation is to eliminate the initial cause of cell injury, clearing out the necrotic cells and tissues damaged from the original insult and the inflammatory process, and initiate the tissue repair. So this is seen in the early stages of dysplasia. So as Vranasofa is described as Purva Rupavastha of Granthi or Vidradi. Granthi can also be considered as a pre-malignant lesion. So Sotatastu Gatra Vaivanya Sritate Sthana Dusha Kriti Nama Vedat Aneka Sankhya Katichat Tesham Nidarshanartham Gadato Niboda. In the Charaka, this reference you can see, he has included Arbuda Granthi with Shota due to similarity in the basic clinical feature. That is swelling or protuberance situated in different body parts. Tumor means swelling caused due to the inflammation, cyst, benign growths or cancerous growth, anything it can be. And the cancerous tumor particularly grows rapidly and it will metastasize, and with new blood vessel formation. In the Latin also, the word tumor means swelling only. So this Pranashophavastha can be understood as a pre-malignant lesion. So coming to the Sanchaya Avastha, stage of accumulation, increase of the doshas in their own site, that is HPV, host cells lodging this HPV, going into metaplasia of the cervix, that is Sanchaya Avastha. Prakopa is stage of aggravation, the accumulation of doshas in their own site in Prakopa Avastha, that is dysplasia, early stages of CIN1. Prasara is the stage of spread, hyperexcitation of the doshas and spreading to the site of manifestation, that is CIN2, 3 we can consider. And next complications are the Vyakti Sthana Samsraya Beda Avastha, that is developing into the carcinoma, invasive carcinoma or established cancer cervix condition. So if you want to integrate the approach, this is a Shatkriya Kala Avastha you can integrate to prevent the progression of the cancer. So the fundamental aim of Ayurvedic therapy is to restore the balance between the three major biological forces of the body, that is Tridosha. Any imbalance can lead to inflammation.
You feel pain in your back region?
Excuse me, who is talking? Hello, who is talking? Delegates? Hello.
So the basic pathology we can understand involved in this neoplasia is Mityahara Vihara, diet, abnormal diet and lifestyle, leading to Agnimandya, decreased digestive capacity, in turn leading to Dhatvagni Mandyata, that is affected tissue metabolism in the adverse way, and Dhatu Poshana will get afflicted with this, that is utilization of nutrients by cell will be decreased, leading to the ama formation, that is resulting in the endotoxins and leading to the imbalance in the Tridosha biological forces, loss of coordination, that is Shoto Vaigunya, leading to the excessive metabolic crisis resulting in proliferation of the abnormal cells. So this excessive metabolic crisis resulting in proliferation leading to the increased pitta at the cellular level can cause micro-inflammatory changes and disturb the cellular components of Agni, that is the Dhatvagni, and the Tejas component of vitiated pitta enhances the metabolic activity of the cancerous cells. So this is a basic pathology. Tejas component of vitiated pitta enhances the metabolic activity of cancerous cells. So this leads to the vitiated kapha leads to the responsible for abnormal growth of tumors, And vitiated Vata is the active dosha and is involved in the process of metastasis. So these three doshas involved in three basic pathology of development of carcinoma. So three doshas maintain equilibrium in the body. The general approach to this treatment protocol will be kindling of Datva Pipachana, that is eliminating the toxins, Shroto Shodhana and Lekana, scraping of the dysplasia in the local treatment. So this is the basis of the integrative approach. So when you see this, what strategies we can apply? So preventive, curative and palliative. So in the preventive care, care starts right from Rajaswala Paricharya. So first one is Rajaswala Paricharya, preconceptional care, Sutika Paricharya and Shodhana. So we'll see how the Rajaswala Paricharya helps in preventing cervical cancer. So in the Jeffcott also textbook of gynecology, you can see the difference. Orthodox Jews are immune to cervical cancer because they strictly avoid coitus not only during the menstruation but also few days after the menstruation, at least up to 5 to 6 days post-menstrual period. So this will definitely help in reducing the incidence of cervical cancers. So some may practice coitus during the menstruation, which is a potential dangerous for the development of the pre-malignant lesions and further into cancer cervix. So avoiding coitus during menses is very important. That is advised in the Rajaswala Paricharya. And one more thing, frequency of coitus. Spermatozoa themselves act as carcinogens because the nucleus acids present in the spermatozoa are very much hostile to the cervical cells. So coitus in the particular period, that is particularly in the post-menstrual period, where the host immunity is less, better to avoid. And other Rajaswala Paricharya advised in Samhitas, that is avoiding the very Tikshna Ushna Ahara and daytime sleeping, awakening in the night time. So these are all nowadays lifestyle changes because of the IT development. So these all things should be advised in the preventive care as part of Rajaswala Paricharya. And coming to the preconceptional care, what factor in this preconceptional care we can advise as a part of preventive care in cervical cancer, because the genetical point plays an important role here. If the couple are having abnormal genes because of their Midyahara Vihara, that is abnormal dietetics and lifestyle, without proper preconceptional care, the offspring will also have an unhealthy tridosha balance. So this will lead to the development of any type of cancer, not only cervical cancer, any type of cancers in the adulthood. So genetical correction, that is the DNA methylation and RNA modulation correction with this Putriya Vidhi or preconceptional care definitely will help in preventing the cancers. So this is a preconceptional care we have to adopt. So this is, you can see in the Putriya Vidhi, the text has explained how to take the preconceptional care. Yavam jata rupavanta sattvavanta chirayusha. If Putriya Vidhi is adopted, rupavanta, sattvavanta, that is with good immunity, and chirayusha, longevity is good. So this offspring can be assured. So Shodhana Chikitsa for couple has to be given before conception. So basically it is Madhuraushadha Siddha Samskrita Grita, Kshira for male and Masha and Taila for the female. And some mantra prayogas are also given, but in spite of mantra prayoga, we can advise some spiritual practices. So practically what we can give in the preconception care. So start with the Virechana followed by Yoga Basti and give internally Gokshura, Ashwagandha for Bija Shuddhi. And Jirakadya Rishta and Dashamula Rishta for the Kshetra Shuddhi of the female internally for minimum 4 weeks period. And then give Trikatu Churna with Swarnamakshika Basma or Swarna Basma, Nagakeshwara Churna for the preparation of the Kshetra, and Kashaya Basti, that is Dashamula, Matra, Dashmula, and along with Matra Basti, some with Vatahara Daila can be given as Kashaya Basti or Yoga Basti form, and along with Yoni Pichu with Balataila Dhanvantari. potential Vatahara Tailas, and Uttarabasti with Kukulu Tiktaka Grita plus Kashmiri Taila Arkrita, Panchatikta Kukulu, and Tadimadi Krita. So Kashmiri and Kutacha Grita will be more beneficial in the form of Uttarabasti. And Rasayana Chikitsa for the correction of the Ambu, that is the Rasayana part of the 4 factors of the pregnancy. Haridra, Amlaki, Kuduchi, Ashwagandha, any of these can be given for at least before conception, 6 weeks period, along with the routine folic acid or whatever the vitamin supplements we are giving. So this preconceptional care will help in correcting the abnormal DNA methylation and help to prevent the offspring tridosha abnormalities which can develop into in the adulthood cancers. So coming to the Sutika Paricharya, what way Sutika Paricharya will help in correcting the or preventing the precancerous lesion or cancer? So different school of thoughts are there, Charak, Shushrut, Vakpat, Kashyapa, etc. So everybody has accepted except Kashyapa, 6 months he has advised. 6 weeks specific Sutika Paricharya has to be given. So this is genetical constitution, living area is given due consideration. So more emphasis is given to introduction of diet, mode of living, maintaining psychological harmony. This will help, and how this will help, I'll explain. So it will, if not followed Sutika Paricharya, that will result in nearly 64 types of diseases of all systems which are cured with either difficulty or not curable. Out of which, displacement of genital organs, inflammatory conditions of genital organs, menorrhagia, Raktagulma, that is neoplastic growths is also there. So it is easily understood Sutika Paricharya, if not followed, can lead to malignancies. It's a definite reference we can see in our classics. So combining all the thoughts, what we can do in the Sutika Paricharya. So we have to start with, everybody know this, but just a brief brush up of the Abhyanga Taila, being oil massage to pacify Vata, administration of Sneha or fats with Deepaniya, Pachaniya and Shodhaka drugs, Vatahara Kashaya given orally, and bath with the lukewarm water, boiled with the herbs, that is particularly Nirgundi, Rasna, etc., which is having potential Vatahara property. So in the diet, the rice gruel or evapo with gruta and kshira, milk and ghee prepared by this anabolic drugs like Vidari. In first 7 days has to be given, and after 7 days, the shali or rice with the meat soups can be given, considering the strength and digestive capacity. Here in Sutika, most important thing is digestive capacity. And Avagaha Sveda, seeds bath can be given for the perineal area. And according to Kashyapa, this Paricharya should be based on the living area, Anupa, Jangala, etc., for the particularly for the Sneha Yukta and Sneha Rahita preparations. So what this will do, this Sutika Paricharya, what it will do in prevention of the cancers. This Sutika Paricharya, basically, it will prevent autoimmunity. So this autoimmunity can trigger the cancers. So how this will prevent the autoimmunity? Whatever the drugs we are giving in the Sutika Paricharya, they are bioavailability enhancers which boost up the metabolism, antidepressant and anti-stress action, adaptogenic effect will be there, that is stress relieving, ulcer healing properties, antimicrobial activity, immunomodulator activity, anti-tubercular activity, antioxidant properties, anti-diabetic, anti-inflammatory. So the list goes on like that. Whatever the Paricharya we are giving, this is the help we are getting for the Sutika Paricharya. So this will prevent autoimmunity as well the root of cancers, that is the development of the cancers. So the rationality in this Sutika Paricharya is to restore the strength of the lady with systematic approach, not to burden the digestive system, immediate postpartum period, to bring back the body physiology and hemodynamics to normal state. So it is in turn help in preventing the autoimmunity as well the cancers. So the etiological factors so far we have discussed, influence on the epigenetical mechanism, that is the diet, lifestyle, etc., which will get altered and result in the DNA methylation and RNA gene expression. This will be altered. So this can result into the development of the malignancies. So whatever that we are taking the preventive strategies, this methylation and RNA gene expression can be prevented in an adverse way and can be helped in preventing the development of the malignancies. So the Arbuda versus malignancy, how can we understand this? Already discussed Asadhya Arbudas, Hridoshaja, Mamsaja Arbuda, Rakta Arbuda, fast growing, which can be related to cancer cervix. So these three doshas maintain the equilibrium in the body. So the general approach to this treatment protocol will be the kindling of Tatvagni, Pachana, Shroto Shodhana and Lekana, that is scraping out treatment for the dysplasia. So coming to the pre-malignant lesion treatment, what curative approach we can give? So yearly once, at least, if you diagnose CIL 1, 2, 3 in an younger age group, ask the patient to go for Vaman, that is the biopurification by MSS, at least yearly once, and Kshara Karma, that is cauterization of the local tissue where you are seeing the dysplasia, one sitting yearly once. If it is again developing, we can repeat it after 1 year, and Yoni Prekshadana, vaginal douches for 7 days, once in 3 months for 1 year, that is 4 times in a year, and Yapana Bastis, medicated enemas, like particularly Madhutailika Basti, yearly once. And internally, tablet Chandra Prabhavati 500 mg twice daily, Guduchi for immunomodulation 250 mg, or even you can give Nisha Amlaki potential immunomodulator in 500 mg twice a daily dose. So how this will act? Mode of action, Kshara Karma, how it will act, which is we are giving the local application. So most commonly we use the Tutta Kshara for the local application or for the cauterization effect. This Ksharanat Chananatva Ksharaha, that is Kshara mobilizes peels of vitiated muscular growths, tumors, and this basically the carbonates and hydroxides of the plant roots. So surgical, parasurgical procedures, Kshara is considered as superior. So it will do the action of Chedya, excision, and also Bedya, perforation, Lekhya, scraping effect, having the Doshagna property, that is eliminating the pathogenesis. So most commonly used is Tankanakshara, Apamargakshara, and Tuttakshara particularly it is more convenient to use. Any three of these Ksharas can be used. And Yapanabasti mode of action is rectal administration of drugs increases the absorption as it bypasses the enteric circulation, and particularly Yapanabastis are immunomodulatory. So this Yapanabastis arrest the disease progress. So another important factor in the Nisha Amlaki, what we give, the curcumin, it is a natural phytochemical with potent anti-neoplastic property, including the modulation of P53. So P53 is a potential component which is having the, it has been suggested important strategy, that is targeting P53. It is having a potential immunomodulatory effect and anti-cancer effectivity. So this P53 gene is activated with the administration of curcumin. So the purpose of this study was to describe a mechanism by which curcumin restores P53 levels in human cancer cell lines. So the study has been conducted by this one research group, which you can see the publication AGTCAM on the mice, their short-term in vitro cytotoxicity on DLA cell. So this has been quite encouraging activity of curcumin because it has potential anti-inflammatory, immunomodulatory, hepatoprotective, antimicrobial, antioxidant, and anti-carcinogenic. You can also see the publication in IJPRS. So this is one of the case which is having a pre-malignant lesion treated with the same protocol what I have given. So this you can see, first picture is the July, then slowly the response in the, after 6 months of the treatment, this is a response you can see. And finally, this is the final picture after the complete freedom from the CIN1. So this is in the December 2015, that is almost after 7 months of the treatment. So this is one case of CIN3. You can see the mahogany brown changes here. This is oyster pearl changes in the cervix with the application of acetic acid. But the patient was refusing hysterectomy. We have advised hysterectomy because her age is 55. So we have to see the age also when you see high-grade pre-malignant lesion like this. But she has refused hysterectomy. Finally, within 3 months, she landed into invasive carcinoma. So this is the importance of proper diagnosis and advice of the treatment. You should not be tempting to give Ayurvedic medication in high-grade lesion like this.
Ma'am?
Yeah, hello.
Ma'am, just to remind you that we are short in time, ma'am.
Yeah, it's over. Last slide.
Okay.
So, in such conditions, we should not go for the integrated approach because hysterectomy will be the better option in this type of cases. So, in the palliative treatment, if any invasive cancer patient comes to you, so these are the things you can do: Yoni Davana, internally Chandana Kwata, Gomutra to prolong the little bit of life and quality life also. So the take-home message is, due to the long latent period of cervical malignancy, regular screening helps to prevent the effect of development of the invasive cancer. Ayurvedic integration helps to preserve uterus in the early stages and in the young age. Long-term follow-up must be ensured in such cases. Teamwork is very important. And by the visual inspection with acetic acid and leukocytin are the most promising methods of screening in the low resource setting. So this is the take-home message for integrated approach in preventing the invasive cancers. So these are some of the pictures before and after treatment. So thank you one and all for the patient listening. Once again, I would like to take the opportunity to thank the organizers of Wardha College and also all the audience, my chairperson, Dr. Kamini Timar Madam, and co-chairperson, Dr. Anita Madam. Thank you so much.
Thank you so much, ma'am. Really very informative session for us, ma'am. Thank you so much, ma'am, for as you take lots of efforts for us also. Thank you so much. Now I request to Dr. Kamini Dhiman, ma'am, please give your expert comment about this session.
Yes, let me intervene. Dr.
Yes.
Kamini Dhiman madam has just left the meeting because she was about to board the flight, and she conveyed her regards for the conference, as well as she has conveyed that her best wishes to Dr. Vishala Turlapati madam for her nice presentation. Actually, she has handed over the charge to me to express her views about your presentation, madam. So she has said that this was a brilliantly informative session, no doubt about it. And even I was throughout the session here, and you have given a collage. You have given us a kaleidoscopic presentation of the scope and the vast area of gynecological malignancies and care through Ayurveda, which we can offer to the patients. You have provided a lot of pictures, picturesque images. You have given the before after data. You have given the presentations, publications. So this was a very wide informative data that you have given to the audience. And thank you very much for being with us today. And thank you for giving your valuable time to our conference, madam. Thank you very much.
Thank you so much, ma'am. On behalf of Dr. Anita Vanzari, ma'am, I'm really thankful to you, ma'am. Sheetal, ma'am,
yes,
may we proceed for next session?
Yes, madam. Yes.
Yeah,
Just confirm whether Dr.
Yes, ma'am. Now this session is going to end here, ma'am. Thank you so much, ma'am, for your valuable opinion and guidance.
Thank you.
Thank you, ma'am. Thank you so much. Now, I request Dr. Pooja Srivastav. Dr. Pooja, are you there?
Yes, ma'am, I'm here only.
Okay. So now I hand over this mic to Dr. Pooja Srivastav. Thank you so much. Thank you.
Thank you so much, ma'am. A very good afternoon to all. Myself, Dr. Pooja Srivastav, Associate Professor in the Shalya Tantra Department, MGACHRC, welcome you all in our next session. For this session, we have Dr. P. Hemant Kumar Sir as speaker and Dr. Prakash Dwivedi and Dr. Sheetal Asutkar Ma'am as chairperson. I welcome you all. Dr. P. Hemant Kumar Sir, Professor and HOD in PG Department of Shalya Tantra, National Institute of Ayurveda, Jaipur. Perceived MS Shalya Tantra from the Institute of Medical Sciences, Banaras Hindu University, Varanasi, and PhD in Ayush Shalya Tantra from National Institute of Ayurveda, Jaipur, Rajasthan. Hello.
Please continue, Dr. Pooja.
Sir, I have attended 92 workshops, 28 seminars, 46 conferences, 9 symposiums, 41 reorientation training programs, 98 continued medical education program, 127 webinar. Sir has presented 18 paper presentations. Sir has 118 publications. Sir has published 7 books. 197. Sir has appeared as a 190 as a guest lectures in 197 events. Sir has 10 radio talks, 12 TV talks. Sir has guided 44 Shalya Tantra PG scholars, guiding 4 Shalya Tantra PG scholars, guided 16 Shalya Tantra PhD scholars, and guiding Shalya Tantra 5 PhD scholars. Sir has received various awards like Acharya Award in 2017, Sushruta Ratna Award in 2009, Best Teacher Award in 2008, Best Doctor Award in 2006, Best Doctor Award in 2007 again, Bishak Award in 2010, Proctologist Award in 2012, Janahit Manch Award in 2016, Young Sushruta Award in 2019, Best Teacher Award again in 2021, Vagbhat Bhushan Award again in 2022. Now we have Dr. Aman Prakash Dwivedi sir as our chairperson. Sir has completed BMS, MS and PhD from esteemed R.A. Poddar College, Government Medical College, Mumbai. Dr. Dwivedi sir is an academician and consulting Ayurveda surgeon, presently working as Vice Principal, Professor and Head of the Surgery Department at renowned D.Y. Patil University, Navi Mumbai. Dr. Dwivedi sir has authored books on various subjects such as urology in Ayurveda, cardiology in Ayurveda, parasurgical procedures in Ayurveda, obesity in Ayurveda, and published more than 100 research papers in national and international medical journals. He has received patent for his innovation, Char Sutra Carrier application device by IPI India, also conferred upon many awards, Aryabhatta Award, International Excellence Award, Sri Lanka, Malaysia, UAE and Thailand, Dhanvantari Award for his research in the field of Ayurvedic surgeon. He is also recipient of Governor's Corona Yodha Award for his exemplary contribution as healthcare professional. Our next chairperson for this session is Dr. Sheetal Asutkar Ma'am, HOD, Head of the Department Shalya Tantra, Mahatma Gandhi Ayurveda College, Hospital and Research Center, PG Guide as well as PhD Supervisor, PG Co-Convener in the same institute. Ma'am is performing general and rectal surgeries and served thousands of patients with medical and surgical skills. She's having 22 years of teaching experience, more than 50 publications in national and international journals. She is on Ayurveda Advisory Board of Hungarian Ayurveda Medical Foundation for 10 years from 2020. She has published 4 books and 5 chapters. She is international speaker on leash therapy and various relevant topics. She has extraordinary performance as a guest speaker on parasurgical and surgical conditions appreciated globally. Ma'am has organized 15 mega conferences and 6 workshops on national and international levels in capacity of organizing. Secretary. Ma'am has chaired various sessions in national and international conferences. She is resource person on various topics related to Shalya Tantra at multiple levels. Organized surgeries lecture series on Ayush Darpan channel in 2021, which included more than 60 lectures by global stalwarts in the field of Shalya Tantra. Ma'am has received Best Teacher Award 2021 and 2021, Young Dynamic Speaker Award in 2021 and Dhanvantar Award in 2022 by Ayush Darpan Foundation, India. Thank you, ma'am. Now I would like to invite our guest speaker, Dr. P. Hemant Kumar sir, to deliver his lecture.
Namaskar.
Namaskar, sir.
Namaskar.
Namaskar,
Namaskar,
sir.
madam. Sital, madam. Divedi, sir. Namaskar. Shall I start?
Please, sir.
Yes, sir.
Yes. But it is coming host disabled participant screen sharing.
Just a minute, sir.
No. Now slides are sharing.
Yes, sir.
Now?
Yes, sir.
Okay. Shall I start?
Yes, sir. Please.
Okay. Thank you. Om Dhanvantaraya Namaha. Om Manjunathaya Namaha. Respected Sital Asadkar, madam, and my dear colleague Dr. Amar Dwivedi ji, and all other respected faculty members and PG, PhD scholars and other doctors from Ayurveda fraternity. First of all, I am thankful to Sital madam for giving opportunity to share my knowledge in this webinar. Today, we are going to discuss about what is cancer in Ayurveda, with present modern perspective, and what I am practicing as an Ayurvedic surgeon, that is focusing today. See, this is our institution, National Institute of Ayurveda, Bhimutuni University, and it is our NABH accredited university, NA hospital, and NAC accredited. See, before starting the cancer topic, just I want to focus my department, Shalya Tantra department, what achievements and what service we are giving to the society. And we have the units like endoscopic unit, Anusastra unit, cancer OPD, orthopedic and Marmachikitsa unit, anorectal unit, general surgery unit. And this is anorectal unit, treating all anorectal disorders. General surgery unit for general surgeries. And orthopedic and Marmachikitsa unit, we are treating fractures, dislocations, musculoskeletal disorders with our Ayurvedic management, along with the surgical procedures like open reduction, intramedullary, screws, plates, etc. The endoscopic unit like gastroscopy, colonoscopy, and sigmoidoscopy for the diagnostic purpose. IPD, operation theater with all facilities. See, this is the main vision of our department, that is hand-to-hand surgical training. We can train our scholars by hand-to-hand training. This is the logo of our department in NIA. See, these are the major surgical procedures we are performing in our operation theater in the department, like appendectomy surgery, gallbladder surgery, and urinary bladder surgeries, all hernial repairs, etc. And orthopedic surgeries like amputation, above knee amputation, below knee amputation, and tendon repairs, intramedullary nailing, fixation, wiring, screws and plates, fixation, etc. And reconstructive surgeries like rhinoplasty, oroplasty, or skin grafting, and all proctological procedures like fistulectomy, rectal polypectomy, hemorrhoidectomy, anorectal abscess, IND, etc. And all minor surgical procedures like lumpectomies, excision of cyst, excision of benign tumors, excision of the malignant tumors, and especially hydrocele, circumcision. These are comes under minor surgical procedures. And Marma Chikitsa practicing in musculoskeletal disorders like frozen shoulder, low backache, tennis elbow, cervical spondylosis, etc. And bloodletting procedures, Agni Karma, thermal cautery in various musculoskeletal disorders, Kshara Karma, treating in internal hemorrhoids, rectal polyps, etc. And Kshara Sutra in anorectal diseases, especially for fistula in ano. And we started 6 months back, first time in National Institute, laparoscopic surgeries. And we started laparoscopic procedures like lap cholecystectomy, etc. And we are also practicing laser surgeries. Diagnostic tools like video rectoscope, fistuloscope. And we have a separate simulation lab, that is Yogya Karmagar, for training to our PG and UG scholars. This is anesthesia mankind, just like a human body. We can create the clinical cases and we can revive and we can give the treatment on mankind. And it is a connecting with anesthesia working station, ventilators, etc. And we create the case and we can revive the case. And mock drills to manage emergency conditions like CPR, cardiopulmonary resuscitation, and endotracheal intubation, etc. And within short, we are going to purchase this laparoscopic simulator and gastrocolonoscopy simulator. And within 6 months, the modular operation theatre will going to open. And we have 3 operative theatres. One is for general surgery, another is for orthopedic surgery, another is anorectal surgery. And these are the statistics from last 10 years, gradually increasing our major operation theatre statistics. Coming to topic, I think morning to started, so many experts, they started about Arbuda, cancer, and etc. Regarding management. In my view, and along with the modern perspective, what we are practicing here and what concept by the Ayurvedic concept with the modern perspective. See, Arbuda is derived from the root Arbuda with the suffix N, with augmentation of ND. See, it means it destroys particularly by the Mamsa Dhatu. It denotes fleshy outgrowths, is called as Arbuda. See, already there are different quotations in classics. Arbuda Parvata Vishesha iti Medoni, Arba Himsa Tasme Udeti iti Arbudaha, Mahati Grandito Arbudaha. See, finally we conclude that any glandular enlargement is called as Arbuda. See, coming to etiological factor, there is a Viparkushta Nidana and Sannikrushta Nidana. And Viparkushta Nidana is Bijas Dushti and Kavaya Gognya. Definitely there is some of the cancers are seen in the families continuously. For example, sometimes grandmother is suffered with CA breast and mother and granddaughter. Like that, there is a Teja Dushti also is there in cancer formation. These are the various Sannikrishna Nidana mentioned in our classics like Alpa Ahara, Ruksha Ahara, Katu Amla Ahara, Viruddha Vishama Ahara, and Vidahi Abhishanda Ahara, and especially excessive intake of smoking and alcohol. And Sannikrishna Nidana Vihara, especially lack of exercise. We have seen that so many surgical, especially cancer conditions like lack of exercises leads to excessive body weight. If excessive body weight, the obesity is one of the important causative factor to development of adenocarcinoma of the cervix and endometrial carcinoma. And CA breast and Nidra Divasabhanam should be avoided. And other Atapa and Srama also another Sannikrishna Nidana Vihara. Then Artavadusti, I am giving an example. Menstrual factors plays an important role in Stri Rogas like amenorrhea or irregular long menstrual cycles, increases risk of endometrial cancer. Early menarche and late menopause are the best examples for risk factor for CA breast and endometrial cancer. See, that's why Artavadusti also very important role to develop cancer in females. See, this is the Samprapti Ghatakas like Sanchaya, Agnimandya, Dosha Prakopa, Sroto Dushti, Kavaigunya, Arbuda, especially Mamsa Arbuda and Rakta Arbuda, Dvyarbuda and Adya Arbuda. See, these are Samprapta Ghatakas, like Dosha is involved, is Kapha and Vata predominant. Dusha is Mamsa Medu and Rakta. Srotas is Mamsa Medu and Raktava Srotas. Sangha and Grandhi is for Soto Dushti. Agni is involved is Jataragni and Dhatu Agni. And Roga Marga is Bhakya Marga. Udbhavasthana anywhere in the body. Adhisthana is especially sixth layer of the skin, Rohini. And Pratyatma Linga is Mamsopachayata Sopam. See, these are the various Samprapti Ghatakas to involvement to the Arbuda. Coming to classification of Arbuda, first you mind it, Arbudas, all Arbudas are not malignant tumors. Arbuda we can consider as a tumors. It's maybe benign tumor or maybe malignant tumors. See, Mahat Grandhito Arbudaha, Susata mentioned, Grandhi, if it is in enlarged size, they consider as Arbuda. See, Grandhi, maybe it is comparison with the cyst, but the clinical features looks like, especially for benign tumors, we have seen like Vata Jarbuja, Pitta Jarbuda, Kapha Jarbuda, Medo Jarbuda. It looks like almost Grandhi Lakshanas, but they considered as a benign tumors. See, Vata Jarbuda, and it is clinical features mentioned by the classics, like pains, different types of Vata Vedana is there, hard in consistency, easily curable, and nature of pain, especially in Pitta Jarbuda, it is burning pain, fuming, sucking, throbbing, etc. These are all we can see that is painful condition of the benign tumors we can consider as a Vata Jarbuda, and inflammatory conditions of benign neoplasm tumors considered as a Pitta Jarbuda. And Kapha Jarbuda we can see it is also easily curable and benign origin like fibroadenomas, fibrolipomas are also considered as a Kapha Jarbuda. And thyroid adenomas, parotid adenomas, these are comes under Kapha Jarbuda. And Medo Jarbuda commonly we are seeing in the practice almost it is looks like a lipoma. The benign tumors origin from the fat tissue, the considered as a lipomas, it comes under Medo Jarbuda. It is also easily curable. Vataja, Pittaja, Kaphaja and Medo Jarbuda is curable. Then coming to Rakta Jarbuda, it is looks like a carcinoma or maybe it is looks like a malignant tumors from various origin. And some of the examples I have given like a carcinoma of the tongue, carcinoma of the cheek, carcinoma of the penis, they involved blood tissue, and they consider as a Rakta Jarbuda. And Mamsa Jarbuda, the origin from muscle tissue, it is also considered as a malignant tumors. I am giving the soft tissue sarcomas, testicular cancers, etc. They are considered as a Mamsa Jarbuda. And there are very important terminology used by Susruta, Adya Arbuda and Divya Arbuda. See, these two Arbudas you can consider as a metastatic tumors. Metastatic tumors, especially I have given one example here. If it is a carcinoma of the breast in 4th stage, you can go for TNM classification. It involves the metastasis, maybe lymphatic nodes, lymphatic metastasis. At a time, we can see in the same place. Primary focus in the breast and secondary focus on plasmatic tumor. Sorry, the Balava, we can see that. And Upasaya, Anupasaya factors, these are the Upasaya, Anupasaya factors. And see, usually is what we can say, malignant diseases can consider 3 groups. In first group, the clear malignancy. There is no doubt at all. They are clear malignant tumors or malignant conditions like Mamsa Arbuda, Rakta Arbuda, Mukha Arbuda, carcinoma of the oral cavity, Tridosha Arbuda, Gala Arbuda, carcinoma of the thyroid, Asadhyavana. Sometimes you can see the canceretic ulcers, non-healing ulcers also looks like a malignant appearance. Ulcerative growths, they consider as a clear malignancy. And group 2, the disease is considered as a malignant. Okay, may or may not. See, like considered like a head and neck, it is scattered, mentioned in various places, like Mamsaja Osharoga, Galaga, Asadya Galaganda, and Lingarsha, and Tridosha Gulma, in GAT, Asadya Gulma, Asadya Udara, Sahajarshas, and the respiratory system, especially Chayajakasa. See, maybe bronchogenic carcinoma also they considered as a malignant. And group 3, suggestive of malignancy. You must have to suggest maybe or may not, but to confirm with clear picture of biopsies and etc. Like Chataja Visarpa, Tidosja Nadivrana, Tidosja Pradara, Asadya Kamala, Asadya Pradara, these are considered as a suggestive malignancy. So these 3 categories we can consider as a carcinoma or cancer in Ayurveda in a different context mentioned by our acharyas. Then coming to management. See, in management, there is a medical management, parasurgical management, surgical management, or combination. How nowadays you can see chemotherapy, radiotherapy, immunotherapy, surgical management, and combination of any one. Maybe surgery followed by chemotherapy, surgery followed by radiotherapy, or surgery followed by immunotherapy, or some conditions only chemotherapy and only radiotherapy. That is called radio sensitivity and chemosensitivity. Like that, in Ayurvedic also they mentioned as a medical management, parasurgical, surgical, and combination. So coming to medical management, in classics they mentioned can treat medical management followed by the excision, or excision followed by the management, or parasurgical procedures mentioned by according to Rakta Mokshana mentioned by Surunga in Vata Jarbuda, and Pitta Jarbuda they mentioned by the Jeluka, And they mentioned here there is a Panchakarma treatment is Virechana. Kapha Jarbuda, they mentioned about Rakta Mokshana is Alabu. And Medha Jarbuda, they mentioned some lepas for reducing of the lepana karma like Karanya Taila, etc. And some of the herbs used are considered as anti-cancer properties conducted in various studies regarding Ayurvedic medicines like Ashwagandha, Shatavari, Sitapala, Karavira, Ballataka, Haritaka, Gugulu, Kanchanara, etc. And some of the Gugulu preparations we are using in normal practice like Videnga Gugulu, Sobanjana Gugulu, Kanchanara Gugulu, Trifala Gugulu, Kaishara Gugulu, etc. See, this is very important anti-cancer effect proved in Banaras Hindu University under the able guidance of my head of the department, that time Professor G.C. Prasad ji. And he is a very great contribution regarding research work on cancer in various parameters. It is available in net, and also it is available in CCRS. There is a monogram released by our honorable teacher, and he usually prescribing Rohitaka, Ballataki, Estimu. Till today, I am practicing these three drugs with encouraging results. Like I am giving either you can go for Rohitaka Kwada or Rohitaka Arishta, Estemodu Churna or Estemodu Kshirapaka, or you can give Ballataki, either Rasayana, either Ballataki Rasayan, or you can give Ballataki Tel, oil. Like that, these combinations is getting encouraging results in post-surgical condition and adjuvant therapy with chemotherapy, radiotherapy, etc. with encouraging results. See, some of the anti-cancer effects also seen in vegetables and fruits like soybean, tomato, garlic and onion, cabbage, carrot, cauliflower, coffee, corn, beans, etc. There is anti-cancer properties. See, some of the studies conducted according to the organ, according to the involvement of vital organ, they affect some of the medicines as anti-cancer properties like Langali and Chitraka on Garbhashaya, Ballataka on Mamsarbuda, Chakramarda on skin, and Karavira Sarshapa in Majja and Gunja in Gadarbuda. See, there are some of the important Rasayana Prayagas are successfully practicing in Ayurveda like Ballataka Rasayan, Chitraka Rasayan, Silajit Rasayan, Lasuna Rasayan, Pippali Rasayan, Haritaki Rasayan, Gugulu Rasayan. And some of the rasa preparations with cautiously we can use in cancer patients like Hirak Basma and Shankavisha Basma, Tutta Basma, Raudra Basma, Ratnakaras, Abraka Basma, Suvarna Basma, Tamra Basma, Lokanadras. These are some of the rasa preparations are proved as anti-cancer effect. In hematological side effects, especially we can see either after chemotherapy and radiotherapy, they developed some complications or side effects with like leukopenia, thrombocytopenia. Here they are using medicated ghee internally prepared with mixture of Durva, Dadima, Vasa, Pippal. So this is study conducted research in post-chemo and post-radiotherapy to avoid the side effects and complications of chemo and radio. And neurological toxic side effects such as peripheral neuritis and burning syndrome are reduced with medicated ghee, especially prepared with mixture of Musta, Usira, Jyotishmati and Chandan. And especially for skin related problems, dermatological side effects, ghee prepared with mixture of bakuchi, soraliac, arlifolia, that parna bija, karanja, tuvaraka, etc. And coming to parasurgical management, actually parasurgical management they mentioned in the classics, especially Vataja, Pittaja and Kafaja Arbuda and Medoja Arbuda, they mentioned about either Srungavacharana, Jalukavacharana, Prachana Karma, Sira Vedana. And Agni Karma also widely used, especially mentioned Kafaj Arbuda, Medoj Arbuda, and which Arbudas are not responding with Aushadha Chikitsa. We can go for Agni Karma. See, nowadays we can see there is Agni Karma is two types. One is macro method, or you can see micro method. See, macro method is you can use metallic or non-metallic drug substances or heat up to fixed temperature, just what you are practicing Agni Karma. Okay. And micro method using Teja. See, just you can comparison this micro method is look like what you can go for radiation therapy. It is also you can consider as a Agni Karma. See, these are the Agni Karma instruments. And it's very important, some pilot studies we conducted in our institution. Maggotification. See, nowadays very popular is maggot debridement therapy. Maggots. See, this is clearly mentioned by Susruta in Kafaja Arbuda Chikitsa. Kafaja Arbuda Chikitsa. He mentioned about Nishpava, Pinyaka, Kulutta, Mamsa, Takra. I can collect, made as a paste and apply on the infected wound to attract flies. Later, the worms and parasites produced and will consume the tissues of Arbuda. The remnant unconsumed Arbuda should be done either surgical procedure or Lekana Karma and Agni Karma. See, this concept is very clear. You can see, if you see this, is very laughing. But nowadays, very popular in maggot debridement therapy. The concept is what happen if it is a growth, non-accessible growth or very difficult to go for surgery with more waxillarity and fixed growth. Nowadays, what happen before going to surgery, they will go for chemotherapy and radiotherapy. See, this concept Susruta mentioned in maggotification and followed by the surgical therapy. See, this is the medicines. We conducted a study like Nishpava and Pinyaka, Kulutta and Mamsa, Takra. These are the drugs we have taken and make as a paste. Then we apply to the sun. This is interesting case. You can see that this case we applied for maggotic therapy. This is very interesting fixed delayed carcinoma of the breast. Then before going to surgery, we did some maggotification, reduce the vascularity, reduce the size of the breast and freely mobility. After maggotification and we planned for the radical mastectomy. Here is very difficult to approximate the skin also.
सर
That's why.
बोल रहा
Hello.
था सारे आज के प्रोग्राम सारे पहले से ही सेंड कर के दे दिया था सर बोल रहे थे मैंने
And,
Participants, please mute yourself. Participant, I have pinned you. Anup Sachi, please mute yourself.
See, this case, what happened? After reducing the size of the breast and reducing the vascularity, then we posted for mastectomy, radical mastectomy, followed by the skin grafting. This is another case of post-operative case of chordoma, already operated in modern counterpart. Then again there is a recurrence. Then we applied this malignant tumor of the sacrum and we reduced the size of the growth. And this is another case of recurrent post-operative case of oral carcinoma. This is also another case of recurrent post-operative case of oral carcinoma. We treated maggotification. This patient is very difficult to take the liquid diet also. And patient already operated, received chemotherapy, radiotherapy, again they developed recurrence. Then we did reduce the size of the growth with the help of negatification. See, nowadays very popular market, it is available sterile maggots like Phoenicia sericata. It's a sterile maggots are available. Nowadays very famous in non-healing ulcers for applying of these maggots to debride the wounds by dissolving only necrotic and infected tissue, disinfect the wound by killing bacteria, and it stimulate wound healing and biofilm inhibition and eradication. Nowadays very popular MDT. Coming to surgical management. See, surgical management, Susutha is responsible, especially the mentioned about it is not responding with Aushadhi medical management. You can go for surgery, and especially indicated cases like Raktarbuda, Mamsarbuda, Adyarbuda, Duyarbuda. These are all indicated for surgery. And followed surgery, they mentioned by Susutha, especially here they use a tourniquet like iron, zinc, copper. It is nothing but upper limb and lower limb and hanged parts of thing. They advised for tourniquet, followed the excision of the tumor, followed by Agni Karma or Kshara Karma. This is very important. That's why Susutha in Ashtavida Sastra Karmas, they mentioned about Arbuda is a Chedya. Chedya Arbuda. That's why is the main indication of tumor, malignant tumor is the treatment is excision. See, this is the some of the benign tumors we operated, benign tumors of lipoma, excision, and benign tumor of neuroma at brachial plexus, and malignant tumor of the carcinoma, you can go for penile amputation under local anesthesia, and breast carcinoma, mastectomy. See, another case of breast carcinoma, mastectomy. Axillary accessory breast. Actually, it is just like a lipoma. It is a fat tissue is there. It is looks like a separate another accessory breast at the axilla, and we excised. And carcinoma of the thyroid, you can go for thyroidectomy. So huge ovarian tumor, but it is after biopsy, it looks like a benign tumor. It is not a malignant tumor, and we excised this tumor. And this is another interesting case. We operated in SDM College of Ayurveda, Hassan, I think 2004 or 2005. Very interesting case of 9 years female girl. They developed huge swelling, just like a pregnancy. That time the patient is HbSAg positive. Then we operated under protection with HbSAg kit, and we excised more than 5.6 kg, huge lipomatic growth, adhesion with intestines. We excised and safely saved the life of the patient, and it is covered in all media. So this is the case of duodenal cancer. Usually duodenal, very rarely we can see the cancers. But first part of the duodenum, there is a chance of cancer, and we did gastrojejunostomy. And rectal polypoidal benign growth. It is a huge polypoidal growth with severe bleeding. We excised, followed by the Agni Karma. And some of the, what is the main role? I am concluding my session. There are 4 types of management. One is medical management, parasurgical management, and surgical management, or combination of any treatment. Okay. But what is the role of some of the Ayurvedic medicines in cancer? See, this is very important. Our practice we are seeing in various research works on cancer. It says definitely it has adjuvant therapy and beneficial effects on body weight, to hemoglobin, increase the body weight, to increase the hemoglobin, increase the glutamate decarboxylate, to increase the GABA, and advantageous effect, increase the body resistance, and IgE, IgG, IgM turning to normal level. And some of the side effects like chemotherapy, like nausea, loss of body weight, to anemia, skin discoloration, then we can go for our Ayurvedic anti-cancer drugs. And very important, yoga and pranayama and dhyana is very important role to reduce the pain in cancer. Cancer pain is very difficult to control. In that conditions like non-operable cases, metastatic cases, advanced cases, definitely this yoga and meditation is helpful. And normal cancer patients also increase the mental support or reduce the stress. We can go for meditation and yoga. These also conduct study in various centers. Fall in oxygen consumption, plasma lactate concentration, decrease cardiac output and blood pressure, and achieve stable autonomic balance and improves physical efficiency, mental and physical relaxation, reduce anxiety, to increase the threshold of pain. So many advantages. We have seen so many patients following surgery and along with medications, and we are advising yoga and meditation. See, I am concluding my session. What you have seen that I respect my susrutas. I think everybody, and I not seen real susrutas. Why? Because susrutas we are seeing statue. But in my career, we have seen susrutas like Professor G.C. Prasad. The first photo, Professor G.C. Prasad, he is the first person vividly conducted research work on cancer. Is during my post graduation, he is the head of the department, and recently he expired last year. He is a great research worker, great surgeon to practice cancer in different research modalities with collaboration with modern counterpart. So another is my Professor K.R. Sharma. He is the personality of Chara Sutra treatment. And Manoranjan Sahu, now very great moment. We all Ayurvedic surgeons to celebrate this event. First time, I as an Ayurvedic surgeon, Professor Manoranjan Sahuji received Padma Shri Award. And Prasanna Rao, now the principal of SDM College of Ayurveda, and my colleague, Dr. Gopinath, modern surgeon, and my seniors, Manoj Pratap Singh, Sivji Gupta, and Ravi Shankar Barwaje. They are really motivated to practice Ayurvedic surgery. These are all our teamwork in National Institute of Ayurveda. Without teamwork, it is very difficult. All the teaching staff and non-teaching staff and all my PG and PhD scholars. So I'm saying message. Really, I'm not a handsome guy, but I can give my hand to someone who needs help. Beauty is in heart, not in face. So this is very important. What you are practicing, what you have gained the knowledge, pass the knowledge from teacher to the student to survive the Ayurvedic surgery. And I am very thankful to organizers giving this opportunity to share my knowledge. Thank you. Namaskar.
Thank you so much for my information. Now I would like to call our Chairperson, Dr. Amar Prakash Dwivedi, sir, for his expert comments.
Sir, please unmute yourself, Amar sir.
Am I audible?
Yes, sir. Yes, you are audible.
Good afternoon, all.
Again, it is muted.
So I'm thankful to Sheetal Madam, the organizing chairman, and Dr. Devyani Madam, the organizing secretary,
for this e-seminar on cancer care management. This is very important topic, and also I'm feeling privileged to chair this session of my brotherly friend Dr. Hemant Kumarji. Everybody knows who are in the field of Ayurvedic Shalya Tantra. They know him very well. His work is excellent, and through his talk on this particular Ayurvedic and modern perspective in cancer care, everybody
मुझे नहीं आ रहा है।
सर मीटिंग से निकल गए हैं क्या हर्षद? आई थिंक सर इज अमर सर इज आउट ऑफ द मीटिंग. अच्छा, maybe there are some network issues from his side.
Okay, ma'am. Now I would like to request Dr. Sheetala Suttar ma'am for her expert comments.
थैंक यू सो मच. तो ये तो घर की बात है सर कि आप हमारे साथ हैं, and this is always a pleasure to listen to you, sir. I have attended so many lectures of yours since beginning of my career, but it is always something very great things that I always come to know at the end of your lecture. So again, this was a masterpiece from your bouquet, and it's the style of presentation, the content of the lecture that always appeals me. And the way you elaborate things, you highlight your institute, then you go for the content of the lecture today, then you come to your gurus. So this is always inspired me, and I have tried always to follow your footprints, sir. Frankly speaking, this is always a great experience to listen to you. And today it was the cancer, area of cancer, on which you presented in a very, I guess your trademark pattern, I can say. And it was great to listen to you. It was great to go through the slides, and we wanted some more from you on that particular topic. But maybe some next time on some another platform, we would be getting some more content on cancer. And I know you have a lot of things to give to us, but maybe because of the time constraint, you concluded the lecture within short span, maybe. So it was again from all the organizing team, and being the organizing chairman of this seminar national conference, as well as the chair of this session, it was great to listen to you, sir. And I thank you for being here on this national platform of Mahatma Gandhi Ayurveda College Hospital and Research Center. So thank you very much, sir. And
thank you, madam. Thank you.
Thank you, sir. So, Amar sir, I may think I will give him a call. So just be with us for a moment, and we let him complete his comments.
Amar sir.
Sir has joined. Pooja,
Not
please
yet,
look.
ma'am.
इनको पोस्ट में रिमूव ये उसका मैसेज गया तो वहां से भी गड़बड़ हुई है उसको भी पोस्ट करना Most हम बन जाते हैं मार्क्स बना लेते हैं अपने आप को रिमूव करके म्यूट इससे सुन रहे
We apologize for the technical issues. Some technical issues were there, but I think now they have been resolved. So over to you, Pooja.
Okay, thank you so much, ma'am. Now I declare that the sessions are over, but be with us. Soon we will start our valedictory address, probably by 3 p.m.
Hello. Hello. Hello.
Yes,
Extremely
welcome
sorry
again,
for
sir.
extremely
Hello.
sorry for the inconvenience, sir. Amar sir, am I audible, sir? Sir, we are waiting for your expert comments, sir.
Am I audible now?
Yes, sir. Yes, sir.
Okay. I'm really sorry for this technical glitch, and I would just continue with my conclusive talk. Dr. Hemant sir has delivered a wonderful session covering both the modern Ayurvedic perspective on cancer care, and he has covered the nirukti, that is derivation, definition, nidan, category of cancer, elaborated on samprapti, pathogenesis, how it takes place, and most importantly, he shared the evidence-based clinical experiences through the pictures of the patient he has treated. So I congratulate Dr. Hemant sir for excellent lecture, and also I would like to congratulate Hemant sir because today I read somewhere that you are going to set four modular operation theaters at NIA. So all these efforts are definitely just because of you, the surgical person in the department, and really I appreciate your talk. If you think about this cancer, we all know that cancer is the second leading cause of death globally. We all know about this, and there is a significant increase in the incidence and cancer associated morbidity and mortality in Indian subcontinent as it is described in global and Indian studies. So the projection of cancer incidence shows an urgent and need of strengthening and augmenting the existing diagnostic and treatment facilities, which is, at present is it inadequate and unable to handle the current load of cancer in India. If we talk about the Ayurvedic perspective, we all know that Sushruta has described Arbud as a abnormal growth of Mamsa Dhatu, and which is basically due to vitiation of Mamsa and Rakta Dhatu. We all know about the general category which Sushruta has given: the Vata, Pitta, Kapha, Rakta, Sannip, Mamsaj and Medas. These are the classification of Arbud. Actually, we can group this classification. Group one, we can keep diseases which are clear malignancies. And these includes arbud and granthis like Mamsa arbud, Rakta arbud, you can say leukemia and the oral cancers and all. In group T, group 2, the diseases which can be considered as cancer, they're like incurable ulcers or tridosas gulmas, which can be correlated with abdominal tumors, carcinoma of stomach and lymphomas and all. And then group 3, in which we can keep diseases with possibility of malignancy, like erysipelas or incurable jaundice or non-healing nadi brana. So this type of classification we can do as per the symptoms and relation of the doshas. About the prognosis, see, Sushruta has clearly mentioned that Mamsa arbud is asadhya or incurable, whereas Bhagavata says that the Raktaj, Mausaj and these are the types of arbud which are asadhya. The good thing about Dr. Hemant's lecture was he has given idea about certain list of single herbs which are effective in treating the condition like carcinoma. He has mentioned drugs like, and the theory should be like the drug whichever you give should have Deepan, Pachan, Strota Vishodhan, Prana Shodhan, Ropan, Rakta Shuddhikar, Tridosh Samak and Rasayan property. So keeping this into mind, there are many drugs like Chiraita, Bhumya Malki, Pippali, Rohitak, Yashtimadu, which Hemant sir has said. Then we can give even the drugs like Guduchi, Haritki, Musta, Sagar, Chitrak, Ashwagandha, Gokshur, and many trials are going on curcumin, that is Haridra, Bhallatak, Amalki and all. So these are the single herbs which can be definitely tried in patients of cancer. Then there are certain formulations also mentioned in Ayurvedic texts like Lavangadi Churna, Khadiradi Madhu Suhi Rasayan, Kanchanar Guggul. This also Hemant sir has described. Then Panchatikta Ghrut Guggul, Tripura Guggul, Raudra Ras, Nityananda Ras. Then Pradharantak, Laufa, Vajra Bhasma. These can be tried in the Arbud management. And as sir has said, using Jaloka and maggots and those. So in this, I would only add to it that the Ayurvedic parasurgical procedures like Shara Karma and Agni Karma. This is my logic. I don't know whether it will be accepted by all or not. But we can, correlate this Shara Karma with the chemotherapy, and Agni Karma. Can we correlate this with the existing radiotherapy? This is different mode of treatment, but these can be, headed with Ayurvedic parasurgical procedure like star karma and agni karma to chemotherapy and radiotherapy. So to end my concluding remark, I would say that a multidisciplinary approach, including awareness program, preventive measures, screening programs for early detection, and availability of treatment facilities, these are vital for reducing both incidence and mortality of cancer patients. So with this, I conclude my remarks. Once again, congratulations to Hemant sir for giving excellent talk, and congratulations to Shalya Department of Mahatma Gandhi Ayurvedic College and Hospital for organizing such an important topic, cancer care in Ayurveda, through the e-seminar. And I'm also thankful to them for inviting me to chair this session. Thank you, one and all.
Thank you so much, sir, for your valuable words. Soon we are going to start our validity address, so be tuned. So stay tuned.
Excuse me, ma'am. Progress.
ते तसंच करतात. आणि त्याच्यातही मॅडम Oh, so na siya na tam. No pa na. Oh. No pa. Yung kaya
Hmm.